My dear friends, again I am here to help you again with Dr.MedExedu Indian Medical Society. So don't wait for the perfect time. Perfect time will never come to your life. Do it now. इस पिक्चर में आप देख सकते हैं कि कुछ डॉक्टर्स के साथ हम खड़े हैं. इस पिक्चर्स में ये हैं डॉक्टर राजाराम अनंतरमन, सीनियर कंसल्टेंट इंटरवेंशनल कार्डियोलॉजिस्ट, कावेरी हॉस्पिटल चेन्नई. ये डॉक्टर साहब हैं डॉक्टर प्रशांत बैजनाथ फ्रॉम KMCH कोयम्बटूर. इन्होंने MCH किया है. ये दोनों डॉक्टर जर्मनी से हैं, इंटरवेंशनल कार्डियोलॉजिस्ट. हम लोगों की मुलाकात चाइना वाल्व हांगजू सिटी में 2019 में हुई थी. और ये हैं जो आपको लेक्चर दे रहे हैं, डॉक्टर संजय जायसवाल. सो डॉक्टर जायसवाल का विशेष सवाल के साथ हम लोग स्टार्ट करने जा रहे हैं अपना सेशन. ओके, लेट्स स्टार्ट विद MCQ. A 75-year-old Indian male patient presents to your OPD of the famous hospital of the metro city with the lesion shown in the image below. This lesion was present for 2 years. What is the most likely diagnosis? So, from this image, you have to think about. Time is very limited, 45 seconds. So, from this area and this area is already a lesion here, ulcerated lesion affecting the skin of the nose in an elderly individual. This patient is already 75 years old. It is very specific nodulocystic variety of the commonest variety. Actually, there are 4 options, A, B, C, D. So according to the criteria, this is the answer of this question. Why this is the answer of the question? Because BCC, basal cell carcinoma, or we can say basal cell cancer, or we can say basalioma, or another name is known as rodent ulcer, is the most common type of skin cancer in the elderly patient. It often appears painless. A raised area of the skin may be shiny with small blood vessels running over it. It may also present to a raised area with ulceration. Basal cell cancer grows slowly and can damage the tissue around it, but it is unlikely to spread to distant area or result in death. So, what is the risk factor? Actually, you know what is the risk factor? Risk factor. So, there are several risk factors. Okay, several risk factors. Number 1, exposure to the UV rays. Okay, UV rays. Number 2, radiation therapy. Number 3, long-term exposure to arsenic. Number 4, poor immune system. That is poor immune system. Fifth point, exposure to UV light. Exposure to UV light. Okay, UV light. Another point is tanning beds have become another common source of UV radiation. So what is the diagnosis? How we can diagnose? Of course, this lesion related to the skin, skin, okay, skin. So we have to go through the skin examination. Examination of the skin is very necessary, and it can be confirmed by the tissue biopsy. Okay, so the answer is basal cell carcinoma. Another question number 2. It's a very easy question. Identify the condition shown in the image. This image and this image. I have taken this image from the Wikipedia. You can go and see. Which is caused by HPV 6 and 11, commonly known as genital warts. So there are 4 options, A, B, C, D. So which is the answer? Generally, condyloma acuminatum, the causative agents are HPV 6 and 11. It is also known as genital warts. Don't confuse between the condyloma lata and acuminata. Acuminata is warty. Acuminata is warty, T-Y, warty, whereas lata is flat-topped. Flat, F-L-A-T, flat-topped. Okay, flat-topped. So what is the best answer? The best answer is condyloma acuminata. Okay, let's move to our another question. Question number 3. A female patient with prosthetic heart valves has been taking warfarin but has now become pregnant. What advice would you give regarding its use in the early pregnancy? She is pregnant in the early pregnancy. So what we should do now? As we know that she is taking warfarin, and warfarin is teratogenic drug. It can cause fetal warfarin syndrome if used during pregnancy, particularly in the first trimester. So it is replaced by heparin in pregnancy, as heparin is the safest drug. They do not cross the placenta and does not cause fetal malformation. Okay, so our answer of this question number 3 is C. Change warfarin to heparin. So this question is okay. It's a very easy question. Come to the question number 4. Okay, question number 4. Question number 4 is also very important question. Which of the following statement about these drugs is true? Image of the graph given. Percentage increase stroke volume, log of drug. Okay, this is A, B, C, D. Here 4 options has been given. So we have to find the true options. Drug A is the most potent. Drug A is the most potent. Option B, drug A and B have equal efficacy. A and B have the equal efficacy. I don't think so. Drug C is the least potent. Drug C is the least potent. I don't think so. Drug B has more potency. Drug B has more potency but less efficacy than drug A. Okay. So option A is the correct option. Why? Why A is correct option? Why? Because potency means the drug on the extreme left. A. Potency means the drug on the extreme left is more potent. A is more potent. A is more potent. Okay. A is more potent than any other drugs. and A is more potent, then what will happen to D? D is least potent. Okay, least potent. What is the relation of efficacy? It is determined by the height of the curve. Height of the curve. Height of the curve. Okay, height of the curve. Question number 5. A patient on the treatment for myasthenia gravis presents with increasing muscle weakness. Which of the following drugs is used to differentiate myasthenia gravis from cholinergic crisis? Again, here A, B, C, D, and the answer is written here. Hydrophonium. Why hydrophonium? No problem. Because muscle weakness and myasthenia gravis. Okay. Come to the question number 6. A man traveled to Assam. After coming back, he developed fever, chills and rigors and altered sensorium. The peripheral smear demonstrated the presence of the P. falciparum. What is the treatment of the choice for this patient? Question 6. Altered sensorium. Okay. Altered sensorium. Altered sensorium means the patient has cerebral malaria, which is complicated malaria. ACT, artesunate combined therapy, is the treatment of choice for the P. falciparum. If the patient is from the northeast, ACT of the choice will be artemether plus lumefantrine. If the patient is from the other, then ACT of the choice will be artesunate plus sulfadoxine plus pyrimethamine, but this is for uncomplicated malaria. So here the best option will be D, intravenous artesunate. Come to the next question, question number 7. A patient had history of previous child Down syndrome. Currently on the lithium therapy present for the antenatal checkup. Which of the following condition is the fetus at the greatest risk of? 7. It is a congenital cardiac anomaly, that is a congenital tricuspid atresia. Lithium therapy during the pregnancy, particularly in the first trimester, carries the greatest risk, fetal risk for Epstein anomaly. Okay, Epstein anomaly, a rare right ventricular outflow tract defect involving down displacement of the tricuspid valve into the right ventricle. Lithium is a teratogenicity drug. Lithium is strongly linked to the cardiac malformation with Epstein anomaly, being a classic and most specific association due to its impact on the heart development during the organogenesis. So answer is A. Come to the question number 8. Hormones and endogenous substances that are involved in the regulation of the calcium balance in the body. Question number 8. These three are the primary hormones and endogenous substances regulating calcium homeostasis in the body. PTH, that is parathyroid hormone, released when blood calcium drops, increases bone resorption, renal calcium resorption, and activates vitamin D. Vitamin D is calcitriol, enhances intestinal calcium phosphate absorption and bone mineralization. Calcitonin, released when calcium rises, inhibits bone resorption and promotes renal calcium excretion. So what is the answer in this question? Best answer is B, vitamin D, PTH and calcitonin. Okay, come to the question number 9. Come to the question number 9. Okay, come to the question number 9. Let's begin. Question number 9. A village child Which child? A village child presented to the emergency in a comatose state after eating an unknown plant while playing in the village playground. The pupil were dilated and the skin was dry, body temperature is raised, heart rate is high when villagers bring this child to the district hospital. These signs and symptoms can occur with the intake of which of the following substances? As we know that dilated pupil can be due to the sympathetic system or the anticholinergic system. Dry skin due to anticholinergic, body temperature due to anticholinergics. So, datura is a plant, contains anticholinergic substances. Anticholinergic substances. Okay, anticholinergic substances. Poppy seeds. These poppy seeds contain opium. Poppy seeds contain opium. Poppy seeds contain opium and mushroom cholinergic, that is cholinergic, that is early mushroom poisoning. Okay, that is early mushroom poisoning. Okay, come to the next question. That is question number 10. A farmer from a hilly area presented to the emergency department of the local hospital with garlic odor, pinpoint pupil, excessive secretions. Which of the following is the drug of choice for the treatment of this poisoning? I'm sure you people know it. Okay. So what is the answer? Just wait. What is the answer? Garlic odor is seen in organophosphate poisoning and arsenic poisoning. Garlic odor seen in atropine poisoning or organophosphate poisoning. Fumazanil is a drug of choice of benzodiazepine. N-acetylcysteine is a drug of choice for paracetamol. Okay, paracetamol. Oximes are also used for organophosphate poisoning. Okay, atropine is the initial drug of choice for the organophosphate poisoning. Presentation: farmer with garlic odor, pinpoint pupil, excessive secretions, classic cholinergic crisis from the pesticide exposure. The symptoms match organophosphate poisoning, that is dumbbells, D for diarrhea, U for urination, M for meiosis, B for bradycardia, B for bronchoria, E for emesis, L for lacrimation, S for salivation, and S for sweating. So the best option is atropine. I hope you people get some information from this. Thank you very much. Thank you very much for today. This was a small chanting session for you. Thank you very much, my dear friends. If you people like it, then share with your friends. If you don't like, kindly ignore it. Okay? Don't bother. Kindly ignore it. Okay? Thank you very much, my dear friends. Thank you very much. I hope I will keep trying my best to continue next video. Thank you very much.